Quiz. Let your child shine with creativity, confidence, and a whole lot of fun.
iMac Cochin Kalabavan is back with Summer Class 2025, a perfect mix of learning and enjoyment.
From cinematic dance, classical dance, vocal music, instrumental music, to art and craft, drawing and painting, and martial arts, we have got something for every young talent.
That's not all. We have lined up fun activities like field trips, movie time, yoga, games, thrilling competitions, and much more to keep the excitement going.
Worried about transport? We've got it covered.
And for the grand finale, every child's performances will be live streamed on BMC Global Live.
And guess what? All this at an affordable fee so that every child gets a chance.
Admissions are open now, and here's the best part. First 50 admissions get the registration fee for free.
So hurry up, call the number shown on the screen now to give your child a summer full of joy, creativity, and new friendships.
We often hear the phrase, trust your gut. It's not just a feeling, it's your second brain. A healthy gut is a foundation for a healthy body and a clear mind. Good evening. Welcome to another episode of BMC Global Life, Al Hilal Health World, nothing but lifestyle. Today we'll be discussing a topic that is not talked about enough, but we all must have dealt with it at some point in life. Yes, we are flushing out the truth about constipation. And to shed more light onto this topic, we have with us Dr. Jeetu James, specialist pediatrician with over 7 years of experience from Al Hilal Hospital, Hith branch. Welcome to the show, doctor.
Thank you.
How do you define constipation in children?
Constipation is the passage of hard stools with great difficulty, and it will be less often than the normal days. And if it persists more than 4 weeks, it's termed as significant constipation. It's one of the most common problems experienced by children.
Okay. And what are the probable causes of constipation in infants and children?
Coming to the causes, one of the factors is a change in the child's routine, that is a change in the timing of the stooling or any non-availability of toilets especially while traveling. And there are dietary factors, that is a child who has a predominant milk-based diet or who has a food habits that are poor in fiber, children who drink less amount of water, and those who change the infant formulas very frequently, they tend to develop constipation. And the next factor is there could be acute stressful events like any sudden change in home or a change in the school, or it could be during an illness. They could experience a small period of constipation, as well as if there is a death of a near one, that time also children can have constipation. And sometimes the children may be too busy, that means especially during school days, they may be waking up late, so they will be in a hurry to go to school, so they will postpone the bowel movements. Similarly, the children may be too engrossed in mobile, TV or video games that they tend to delay the bowel movement. Also, children might be just lazy to go to the toilet. Sometimes too early as well as forceful toilet training could also be one of the factors for constipation. And reduced physical activity and increased screen time is another cause, and certain medications and medical conditions also contribute to constipation.
Okay. Doctor, many parents often fail to identify constipation at an early stage. So what signs or symptoms should parents look for to identify constipation in their children?
There are certain signs that you could watch for, like if the child is passing infrequent stools, which is the most common sign, then there may be pain while passing stools. Sometimes the children will withhold, there will be withholding maneuvers that the child does to demonstrate that he wants to delay the bowel movement. Sometimes there could be passage of large hard stools or small pellet like stools, and sometimes there could be soiling of pans with liquid soil stools, then bloating and passage of large amount of gas or reduced appetite can also be a sign of constipation. And there could be some children may experience non-specific abdominal discomfort or pain.
Okay. Doctor, what are the underlying reasons or mechanisms behind the development of constipation?
Yeah, one of the mechanism could be a pain. That is, once a child with constipation tends to pass a hard stool, it will be very painful, and the child will want to avoid going or withhold that bowel movement. And it is mainly the fear or the fear that they'll get hurt while passing the stool that prevents them from passage of motion. Similarly, there could be a tear in the passage of the anus called as anal fissure, especially while passing a hard stool, which contributes to pain. And addressing this pain early will help in preventing the with stool withholding and prevent future constipation. Sometimes the children may be in an unfamiliar environment, like sometimes they may not be comfortable to pass the stools in an outside environment. One that can lead to delay in bowel movement. Similarly, during the time of entry to school, children may be worried about the hygiene at school. Sometimes they may be embarrassed to go to the toilet. Sometimes they may be too busy in the morning, especially they may be rushing to go to school. So those can delay the bowel movements. So teach the child that it is okay to go to the washroom whenever it's needed. Reassure them and it's a good idea to always let the bowel decide when to go. And there are certain medical conditions which constitute less than 5% of the cases, like any abnormal thyroid gland like hypothyroidism, any abnormalities of the nerves of the colon like Hirschsprung's disease, and sometimes there could be any abnormalities in the spinal cord or in the development of the anus that could lead to constipation.
Okay. At which 3 key developmental stages does constipation likely occur in children?
The 3 main timelines when the constipation can develop are especially during infancy, when there is a transition from the breastfeed or formula feed to the solid diet. That is the first time. Second is during the start of toilet training. The children who are not ready or are not interested in starting toilet training will avoid a bowel movement and can cause constipation. Sometimes because of the pain, they will withhold the stool and lead to constipation. And most of the children, they may be used to standing up and passing the stool into a diaper or disposable pull-off, which will be hard for them to change to a potty. And the last time is the time of entry to school, where they will be in a new environment, new place, and they might be worried about the hygiene. They might be feeling bad to use the toilet.
Sure. Doctor, you mentioned about toilet training. So when, as per your opinion, when is the right time, the ideal age for a child to start potty training or toilet training?
Ideal age is 2 to 3 years of age, but there is no fixed time as such. It is when the child is ready, when the child can indicate the need, and the toilet training should be gradual, it should be consistent, and it should not be too rigid, and you should avoid starting toilet training if there are any great disruptions or changes in the family or child's routine.
Okay. We also talked about infancy, the early stage. So is it normal for a 3-month-old breastfed baby to have bowel movement only once in every 5 days?
Yes, it's normal. So during the first few weeks of life, the neonate, as the baby is termed as a neonate, will pass 4 soft bowel movements per day, and breastfed infants will pass more stools compared to the formula fed infants. And during the first 3 months of life, the breastfed infants can have 3 patterns of stooling. Either they can pass 3 bowel movements per day, or they can pass a stool after every feed, or they can have a bowel movement every once per week. And coming to the formula fed infants, they'll have 3 stools per day. Some infants who are fed on cow's milk or soy milk containing formulas, they may have harder stools, while those having sensitivity to cow's milk or those having allergies may be started on partially hydrolyzed or completely hydrolyzed milk protein, which may produce much looser stools.
Okay. Doctor, we have often seen kids become stiff or hide from potty training, or they might cry during urination or having bowel movement. What could be the possible explanation for it?
And this is called the withholding mechanism, where the child may try to hide behind the curtain, stand cross-legged, or they may do a dance, or they may hold on to a table and bend forward. And this mechanism is generally used by children to avoid having a bowel movement, because they are having the fear of passing the hard stool. And as you said, the children with constipation can have mild urinary tract infections because of urinary retention, and that happens as a result of stool retention.
Doctor, should parents be worried if a child occasionally skips bowel movements or passes hard stools, and sometimes even with blood?
Yes, it's a cause of concern, because it might be because of the tear in the anal passage called as anal fissure, which can create a fear in the child and cause them to avoid a bowel movement and cause constipation. Similarly, if the child tends to skip the bowel movements for more number of days, it leads to something called as impaction, stool impaction, which is more troublesome for the child.
Okay. Doctor, you mentioned about the symptoms of constipation. So when is the right time for the parents to visit or get a medical attention for the child if he or she is suffering from constipation?
If there is a persistence of the constipation more than 4 weeks, if the child has bleeding while passing stools, any pain, or the child is afraid to evacuate or crying while passing stool, the child constantly resorts to standing up while passing stool, especially in infants, and soiling of the pants, frequent urination or urinary symptoms are there, then ribbon-like stools, especially in a child less than 1 year of age, and if there is abdominal pain with vomiting accompanied with constipation.
Okay. And what are the treatment options typically available for managing constipation?
There could be dietary measures as well as behavioral therapies as well as the medical and surgical interventions. The coming to the dietary interventions, it's mainly make sure the child drinks plenty of water. Getting enough hydration itself will solve most of the problems. Second, you can offer the child certain fruit juices like pear, apple or prunes, which can act as natural laxatives. And while offering fruit juices to children of 1 to 6 years of age, do not give more than 120 ml per day of 100% fruit juice. And for children more than 7 years, avoid giving more than 2 servings, that is of 120 ml each per day. And coming to the food recommendations, encourage the child to have fruits which are fiber rich like pear, apple, prunes, plums, and also encourage the child to have plenty of vegetables like spinach, carrots, cherry tomatoes. Avoid giving or limit the amount of certain foods like milk, yogurt, cheese, ice cream. And you can also give brown rice, oatmeal, that's good for constipation. And you can restrict the screen time of the child and encourage the child for more physical activities. Now coming to the behavioral therapy, it's mainly during the time of toilet training. If suppose the child develops constipation while toilet training, temporarily stop the toilet training, resume the toilet training after 2 to 3 months. Once the child is comfortable, forgets the pain, is passing regular stools, then offer the kid positive reinforcements in the form of hugs, kisses, and words of encouragement for trying, for having the bowel movement, whether or not the attempt was successful. And also avoid punishing the child as well as pressurizing the child. And next is encourage healthy toilet habits. That is, encourage the child to go to the potty 30 minutes after every meal and sit for the potty at least for 10 minutes. And ensure that the child has a foot support, that is a foot rest. The main advantages of having the foot rest is it helps relax the pelvis and the anus. It will help the child to push against while bearing down and help feel the child more stable. And also reading books to the child while going to the bathroom or accompanying the child while going to the bathroom will help keep the child's interest as well as give them more encouragement. And lastly, coming to the medical therapies available, there are oral medicines like lactulose and polyethylene glycol, as well as suppositories we have, and enemas. And for the pain, we can offer a lignocaine jelly with Vaseline, which will help alleviate the pain while passing motion.
All right. That's a wrap, doctor.
Yeah.
Thank you so much for your valuable insights on this topic.
Thank you. Thank you so much.
Remember, when it comes to constipation, always stay regular. Have the fibers in your diet as well as drink lots of water. And parents, make sure your kids meet the dietary requirements and also encourage them to have a bowel movement. For more such informative sessions, please tune into Al Hilal Health World every Tuesdays at 8 p.m. only on BMC Global Life. I'm Abhijit Joseph signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
This July and August, let your child shine with creativity, confidence, and a whole lot of fun.
iMac Cochin Kalabavan is back with Summer Class 2025, a perfect mix of learning and enjoyment.
From cinematic dance, classical dance, vocal music, instrumental music, to art and craft, drawing and painting, and martial arts, we have got something for every young talent.
That's not all. We have lined up fun activities like field trips, movie time, yoga, games, thrilling competitions, and much more to keep the excitement going.
Worried about transport? We've got it covered.
And for the grand finale, every child's performances will be live streamed on BMC Global Live.
And guess what? All this at an affordable fee so that every child gets a chance.
Admissions are open now, and here's the best part. First 50 admissions get the registration fee for free.
So hurry up, call the number shown on the screen now to give your child a summer full of joy, creativity, and new friendships.